Here we go again. This time, it's a 54-year-old woman complaining of some weakness and back pain. Looks like we're gonna do another 12 lead.
Hello, somebody call the paramedics?
Hello? Oh, there she is. Oh, hello there.
Women are at high risk for acute coronary syndromes. You will often face the challenge of correct electrode placement on the woman's chest while trying to preserve her modesty. Begin by explaining the procedure to the patient. Remove clothing on the upper body and cover as much as possible with a gown or towel. The electrodes are placed in the same anatomical landmarks as on your male patients. Place the limb lead electrodes as described previously. Prepare the skin for the chest electrodes. On women, the chest electrodes must be placed under the breast rather than on the breast for an accurate ECG. Place V1 on the right side of the sternum at the 4th intercostal space. V2 is also placed at the 4th intercostal space to the left of the sternum. The V4 electrode is positioned in the 5th intercostal space on the midclavicular line underneath the breast. Place V3 directly between V2 and V4. V5 and V6 are placed level with V4 on the anterior axillary and mid-axillary lines. The 12 lead is now ready to be acquired, printed, and included with your patient documentation.
Well, was I right? This is pretty easy, huh? Now, we've given you most of the 12 lead acquisition story, but we haven't yet given you a whole thing. Now, there are some subtle differences between getting a good clear EKG in the emergency department and getting a good clear EKG in the pre-hospital setting. So what we have to do now is look at some tips and techniques that are necessary to ensure good quality tracings in the pre-hospital environment.
Even with good patient preparation, you may occasionally encounter some difficulty getting a clear ECG tracing. Artifact or electrical noise can distort and obscure the ECG waveforms. To avoid this, eliminate all patient and cable movement. A dried out or expired electrode may also be the source of artifact. Another possible cause of a poor ECG tracing is electromagnetic interference. Something as simple as setting your radio near your 12 lead setup or patient can cause this interference. If you see this pattern, remove or turn off any source of electrical interference. Common sources of interference include cellular phones, electric blankets, radios, poorly grounded hospital beds, and power cords. Obtaining a tracing with a straight isoelectric line is essential for accurate 12-lead ECG interpretation. A wandering baseline is often caused by a loose electrode, patient movement, or for movement during transport. The following may help you prevent or correct tracing problems. Check all electrodes for expiration date and fresh gel. Provide good skin prep. Coach your patient to hold his breath or breathe quietly during ECG acquisition. Reassure your patient to relax with his limbs resting and well supported. Consider stopping the ambulance while acquiring the ECG. Always place the monitor in diagnostic mode for printing. Secure all cable connections and make sure the cable has some slack. Check for cracked or broken cables. Remove or turn off all sources of electrical interference during ECG acquisition. By understanding the principles of ECG acquisition and consistently using correct technique, you will most often get a clean and accurate 12-lead ECG.